Um, I will give some kind of brief summary and then we can dive into questions. This was a really fun Wednesday afternoon for me. Thank you everyone for a great discussion focused on expanding accessibility and reach of evidence-based mental health services through the delivery of digital mental health interventions. We know that traditional face-to-face services can present a lot of different access barriers, and that technology can be leveraged to overcome those, which is why we're all here today. And it's increasingly important for researchers to design inclusive digital interventions for end users from diverse backgrounds. To ensure digital mental health tools meet users' needs and are applicable and acceptable to diverse communities, researchers should include potential end users in the design process of digital interventions, in addition to examining users' attitudes towards and current use of online tools. And so the presentations in this session today really highlighted different methods for including end users and different populations of end users in an exciting way. We had started by hearing off from Emily Hirsch with really interesting work on helping parents learn emotion regulation skills. And as we think through the impact of COVID-19, both in the immediate term and longer term mental health implications, parenting interventions like this one seem key for public mental health. Emily walked us through a really interesting user-centered design process. And from the co-design workshops that she ran, her team was able to gather valuable insights about parents were looking for in terms of emotion regulation skills programs beyond what might be traditionally included in DBT. And so they're now able to expand beyond those strategies to include strategies and supports that are most valued by patients or by parents. Second, we heard from Madison McCall. And this was really exciting work for me because we need to know how people are behaving in terms of information seeking behavior before we can identify methods and means for changing or improving behavior. We know that parental concern is a key driver of early identification and that most parents search for health information online related to their child. And so Madison and her team looked at parents of young children from a community sample, looking at multiple search content domains, and more broadly conceptualized technology devices and sources for health information to get a really clear picture of what was going on. They looked at objective and subjective markers of SES and found that multiple markers of lower SES were more likely, or people with multiple markers of lower SES were more likely to be seeking this kind of health information online. And piggybacking off of what Emily Hirsch presented on, we also emphasized the need for parent stress management types of resources and tools here. And this presentation was really exciting to me because it highlighted the need to develop and disseminate accurate, accessible online health resources that can be trusted and used by parents in need. And in this age of rampant misinformation online, this presentation further motivated me to be focusing on improving health literacy and digital literacy in tandem. Next up, we heard from Dr. Williams about current mental health risk and needs among Black male university students and their preferences, acceptability, and interest in using mobile apps and digital tools for mental health and stress management. And what I really liked about Dr. Williams' presentation was framing this definition of access in terms of reach, relevance, and relatability, noting that resources and tools that are relatable in terms of culture and context are likely to lead to higher levels of engagement. And so we know that Black male university students are underutilizing mental health services, and this set of studies help generate key insights in how we can do better. And then finally, we heard from Dr. Knapp about a really innovative partnership with a community-based teen program in a public library system right outside of Chicago. Libraries are increasingly being recognized as key settings for the delivery of social services. And Dr. Knapp has taken this fantastic community-engaged approach to provide a platform for teens' voices to be heard and to make an impact in their community. The themes that she presented really lend themselves to the design of a mental health intervention to disseminate through a library system. And even more importantly, I feel like her presentation reminded us about the importance of supporting community and community partnerships. And we've been getting some great questions in from the Slack channel already, going in somewhat backwards order, since I just referenced Ashley's presentation. One of the questions was, where would the list of resources be available for teens? As Ashley was talking about providing a list of resources. How are you conceptualizing that, Ashley?
Yeah, so we're actually putting that together. So I think that's going to be part of the co-service or the co-design of the service, would be a repository of both local and national. And Emily Hirsch on the call, we've already started putting it together, and she's taken on the bear of work of getting especially local mental health resources and affordable mental health resources in the Chicagoland area. So all that to say is I think that's going to be a really big part of what we're co-creating and trying to implement and incorporate into the teen services. Emily, anything I missed of all the work you did?
No, I think the resources would be available through the program and also on just sort of our lab website, making that accessible to anyone who comes by.
Awesome. And then Emily, one of the questions for you on the Slack channel was someone being interested in using user-centered design for a project that they're working on, and was wondering a little bit about timeline from inception of the project to completion, and if there's one thing you wish you would have known now that you have more experience in this area.
Yeah, I'd be happy to talk about our timeline. So we first conducted our needs assessment survey to really understand parents' interest in the program and also their willingness to use digital mental health tools for this purpose. And using that data, we created sketches of the Helpers program, and we showed those to parents during co-design workshops. And so based on the feedback we received from parents during these workshops, our next steps are to develop a higher fidelity prototype of the program, and then to test usability using quantitative and qualitative methods such as surveys and feedback interviews. And then after that, we plan to create the next version of our program and then test its efficacy. So in terms of what I've learned from the process, I've learned a lot. It's definitely a time-consuming process and also an expensive one. It's very expensive to pay participants for things like focus groups. And as a student-led project, this was challenging at times. And then I would also say that I learned to create a very rough sketch of the program because you really never know what participants are going to like. So really let the users tell you what they need rather than coming in with a really set or developed sort of program idea. And then lastly, just really think through the logistics of your design sessions, from consent to how you'll collect data, because logistically it could be a little bit challenging. And I'd be happy to chat further about user-centered design. Just shoot me an email.
Awesome, thank you. And then one other question, we have a couple minutes left. A question to all the panelists. The talks were all excellent, of course. As more tools based on AI take off, how do you see trust factoring into each of your projects? And can anyone here share insights on how they think about building trust?
I can go. I kind of want to hear from Madison and Coco though.
I can speak a little bit about building trust. For me in my work, I really focus on, I guess, building rapport with the students that I have in my studies, and take the approach of asking them what they want and need. And sometimes in developing a lot of my materials, I'll get feedback and advice from other Black men about what they would want and what they would look and how, and actually really ask them the question of, especially because I think about a lot about my positionality, being a Black woman doing work for Black men and how they would feel about that. And so I'm really concerned in that area, and I'm always asking Black men what they want. And I think because they are, in my work, they've voiced to me how they don't have that space to speak and how they really appreciate just somebody coming to them to ask them what they want and what they need, and then putting those responses into actions. And I think that goes a long way into building trust with individuals. And specific to tools, it's, like I mentioned, taking what they say and just kind of getting their thoughts and checking with them on throughout the process as you're developing these tools. I think that will go a long way into building trust, and speak a little bit to, whether or not they feel like they can use whatever is made for them.
Awesome. All right. Thank you to a wonderful group of presenters today. Thank you to our attendees. I'm looking forward to being able to continue these conversations and hope everyone has a good rest of your Wednesday. Take care.